Welcome to The Explainer. Today, we're talking about a future that isn't really the future anymore. It's here. I'm talking about AI in the exam room. California is rolling out a whole new rulebook for how artificial intelligence can be used in your healthcare. And honestly, it's a blueprint that could change everything.
So let's just imagine for a second. You get a really important message from your doctor's office, something critical about your health. But it wasn't written by your doctor, or even a nurse. It was written by an algorithm. This isn't science fiction, it's really happening. So the big question is, how can we ever really trust an algorithm with something as important as our health?
Okay, so before we dive into California's new rules, we really have to understand the problem they're trying to solve. When you let AI into medicine without any guardrails, what could actually go wrong?
Well, experts have basically flagged three major red zones. First up, algorithmic bias. This is where an AI could systematically deny care or give worse advice to certain groups of people. Then there's the huge issue of privacy violations. I mean, we're talking about our most sensitive health data getting exposed. And third, and this one is kind of the scariest, a serious clinical error happening because an AI replaced a doctor's judgment instead of just assisting it.
And that's exactly where California's new rulebook comes into play. They've designed a whole set of, you can think of them as digital guardrails, specifically to manage these risks and keep patients safe.
So this new framework, it really boils down to three core ideas. First, we have transparency. A law means you now have the right to know if a message about your health was written by an AI. Simple as that. Second, privacy. Lawmakers are basically taking existing privacy laws and applying them here, making sure your personal health data stays locked down, even from the AI itself. And third, fairness. AI systems now have to be checked for bias to make sure they work for everybody, and they can't be used to trick or deceive patients.
You know, a rule book is great and all, but it's pretty useless without a referee, right? So who is actually making sure that these new rules are being followed?
Okay, so say hello to a brand new job, the AI auditor. And you can think of them as digital detectives for medicine. Their entire job is to look under the hood of a medical AI and certify that it's safe, fair, and transparent before it ever interacts with a real patient.
So the very first check these auditors do is for something called manifest transparency. Now, this is the part you, the patient, will actually see. It's just a clear, simple notice that tells you, hey, you're interacting with an AI. No confusing fine print, no hiding the ball.
But what about the part you don't see? Well, that's called latent transparency. This is the evidence trail for the auditors. We're talking detailed logs, test results, all the records that prove to regulators that the AI is actually working the way it's supposed to and that it's fair. It's how they keep the whole system accountable.
And this is where it all clicks, right? When you put these two ideas side by side, the whole system makes sense. On one hand, you've got manifest transparency. That's what you see, a clear disclaimer, and really importantly, information on how to reach a human. Then on the other side, you have latent transparency. That's what the auditors see. The behind-the-scenes technical proof, the logs, the bias test results. It's a two-part system, and it's designed to build trust from the inside out.
And make no mistake, this isn't just about checking some legal boxes, you know? The California Attorney General's office put it perfectly. The entire point of these rules is to build public trust and to make sure this incredibly powerful technology is being managed ethically.
So how do you actually find bias in a piece of code? Well, auditors follow a really specific three-step process. First, they test the AI's performance across all kinds of different demographic groups. Then, they analyze the results to see if the AI has a negative effect on any one group more than others. And finally, if they find any bias, it has to be documented. And, most importantly, it has to be fixed. Often that means completely retraining the AI model before it's allowed anywhere near patients. Now, to make sure these rules have some real teeth, the state is attaching some serious penalties. We're talking up to $7,500 for a single intentional violation of patient data privacy. And remember, that's not per company, that's per violation. For a hospital system that's interacting with thousands of patients, you can see how that number could get massive, very, very quickly.
So we've got the rules, we've got the auditors, and we've got the penalties. But let's bring it back. What does all of this actually mean for you the next time you interact with the healthcare system?
At the end of the day, all these laws and regulations come together to create a brand new set of digital health rights for you as a patient. You now have the right to know when you're dealing with an AI, you have the right to always be able to contact a human. Crucially, you have the right to have a licensed professional, a person, make the final call on your health, not some algorithm. And you have the right to be protected from bias and to have your data kept private. It's your new safety net for the age of AI in medicine.
So California has put the first real comprehensive set of guardrails in place, and that's a huge step.
But it does leave us with this big, lingering question for the future. As this technology gets smarter and evolves at this incredible pace, will our laws and our ability to regulate them actually be able to keep up? That's really the challenge ahead of us.